Hi, everyone, and welcome back to Beyond the Dental Chair. I'm your host, Brittany Murphy, the myohygienist, your guide to thinking outside the box, expanding your skill set, and making a bigger impact on your patient's overall health. Today, we are going to dive into a topic that can truly transform your success as a myofunctional therapist: how to build a strong referral and networking system, finding the right providers to collaborate, such as ENTs, orthodontists, release providers, body workers. It's key in being able to offer your patient the absolute best care. But how do we find these providers? What questions should we be asking? And what does that great working relationship actually look like? So today we are going to break that all down. As myofunctional therapists, we recognize that airway health is a team effort. You have that team of superheroes, and having that strong network ensures that your patients are receiving that comprehensive care approach. So, working closely with, again, ENTs, orthodontists, release providers, body workers, airway dentists, other allied health professionals, it truly allows for that multidisciplinary approach, leading to much better patient outcomes, much more stable results, right? Retention, and increased credibility, really, for our field. Plus, having that strong, solid referral system can significantly boost your business by bringing in new patients through trusted partnerships across many different disciplines. So, where do we start? This is a great place to start. So, having our airway centered, airway focused provider directories so that we know that our philosophies are already aligned from the beginning. Of course, you still want to, vet everybody, reach out, talk to them. But here are a few examples, and there's so many more. But we have the Airway Health Solutions directory. So we have not only our airway focused providers, dental providers on there doing like expansion, techniques, clear aligner therapy, guidance appliances. There's also our myofunctional therapists on there. So if you're looking for an in-person therapist, maybe that child is going to be doing better with an in-person therapist, you're able to locate them through there. We have the Breathe Institute affiliate website. We have the Airway Circle directory, the AAPMD directory, Light Scalpel, which is going to be more of your release providers. There's directories for cranial osteopaths. There's directories for PTs that are trained in a certain philosophy. There's so many directories out there. So it's a good place to start if you're feeling a little bit, overwhelmed. Other places that we can look for, we have social media, right? Other professional groups. So join those airway focused Facebook groups, LinkedIn communities where providers are actively discussing cases, collaborations. You very well can meet somebody that's in more local to you in doing so. Go to your you know industry conferences, events, whether they're local events or maybe you're going to hop on a plane and go to a conference. You still never know who also is going to be hopping on a plane and going to that conference. So attending industry events like the AAPMD, which is a much bigger conference, all different disciplines. Maybe you're going to find somebody there. Maybe you're going to find somebody there that is also looking for a myofunctional therapist and doesn't have one in their area, and you can be providing services virtually to them. We have myofunctional therapy symposiums like the Myosphere. We have PANI, the Pediatric and Adult Airway Network of New York, has their Myo Night now that they host. There's so many different conferences that you can attend, whether it's pediatric specific, sleep specific. Maybe you're going to attend an ENT conference where you will have the chance to meet potential referral partners in person. Please make sure, have like your little, I don't want to say goodie bag, but like bring everything with you, your business cards, your referral pad. Maybe you have like a one sheet document on myofunctional therapy, or maybe on the back of your business card are going to be different books that you recommend. Make sure that you have something that when you meet these providers in person, they're going to remember you. Direct outreach. Sometimes it's as simple as picking up the phone, reaching out, going in person, finding those local providers, going in person, sending emails, making phone calls, requesting meetings to discuss that collaboration. Make sure, especially when it comes to a dental office, like typically you can't get to the dentist without going through the front desk. And all of you that are listening to this and are in or have worked in a dental office, you all know that the way to our heart are chocolates and desserts. Get to us, and then you'll be able to get to the doctor. So you found a potential provider, and now it's essential that we ask the right questions so that we can ensure that we have the same treatment philosophy and the same patient goals in mind. So we're going to go over some of the key questions that you can ask. So for starters, we're going to talk about ENTs. So you can ask, how do you assess airway obstructions? Are you always performing a scope, a nasal scope? Because sometimes you're going to find parents come back and they're like, oh, they told me that his tonsils are fine. Okay, so they looked in the mouth, they looked at the tonsils, but they didn't do a scope. So how do we know no films were taken? What's going on with the adenoids? What else can be potentially, causing obstruction out there? What age do you start that on? What's your approach to nasal breathing optimization? Aside from removing the obstruction like tonsils and adenoids, what about breathing reeducation? Do you work already with an existing team of myofunctional therapists? Are you familiar with myofunctional therapy? Are you open to collaborating with the myofunctional therapy to increase your patient outcomes? What criteria do you use to determine if a patient needs a frenectomy or any other airway intervention? Let's say child comes in and they are 85% occluded as far as their airway goes. What is their protocol? And I want to also say, like, you always want to make it seem, you always want to be educating them, but in a way where they also feel they're educating you. So sometimes I don't want to say it's playing silly, but a little bit. You want them to feel like you're both offering something to this conversation, right? You're both bringing patients to each other. There's that two-way street going on. Questions to ask orthodontists. Do you prioritize airway health in your orthodontic treatment plans? Do you use appliances that are designed to support jaw development and nasal breathing? Do you incorporate myofunctional therapy into your treatment process? And if so, what types of cases are you typically referring for? Do you assess for tongue posture, other oral dysfunction when diagnosing malocclusion, when talking about the root cause? A very important one also that I don't have on here is how do you assess tethered oral tissues? And once you assess them, what do you do? What's your next steps? Who are your providers that you typically work with? Questions to ask your release providers. What's your preferred assessment method for tongue and lip ties? This is important because you want to make sure that you're speaking the same lingo. Do you collaborate on pre and post-op care with myofunctional therapists, with body workers? If it's an infant with an IBCLC, like, depending on the patient, who is your team of providers that is absolutely essential in order for you to get the best possible outcome for your patient? What tools or techniques do you use for your releases? Laser, scissors or scalpel, combination. Do you suture? Do you not suture? Do you leave it open? What's your protocol as far as post-op care? Like within how many hours do you want patients to begin their stretches? Do you recommend stretches? Do they have their own sheet that they provide to patients? Because it's important, if you start working with them, that you're not giving them two separate post-op care sheets. It should be a combined one, right? Making sure that you're good with their recommendations and they're good with your recommendations. And how do you ensure proper healing and integration? Are there any other adjuncts that they recommend? Are they using serapeptase? Are they using not many people use it anymore, but oh my gosh, not vitamin E oil, although that was once recommended, but not anymore because it, initiates healing too quickly. Oh my gosh, what is the other one I'm thinking of? Oh my God, it will come to me. It has a multiple product line. No, guys, it's not coming to me. I'm sure somebody listening is like, Brittany, it's this. But anyways, you want to know, are they recommending any other adjuncts, warm salt water rinses, alcohol-free mouthwashes? What is their, pain management protocol? Are they recommending that families wake up in the middle of the night to, do their exercises? I have to look this up because it's gonna really just irk me. So give me one sec. Let's see. Um, Post-op, it's a gel, oral gel. My God, Stella Life. Oh dear Lord, I could not remember that. Stella Life gel. I used to use it as part of my protocol. I do not any longer because, again, we don't want to promote healing too quickly. Kenalog injections are also something that other release providers are providing. So, and that's a steroid. So you want to make sure that you get to know your release providers well, their technique, their protocols. Body workers as well. I don't have them listed on here for questions, but you want to know, are they going to go intraoral? Do they have experience working with patients pre and post-op? Do they have experience working with patients going through expansion? What type of appliances do they have, experience with? Get on their table, be their patient. It is a great opportunity to begin that conversation. So now that you found your network, you asked your questions, you share the same philosophy, you're going to start working together. What does a great working relationship look like? So here are what I think key elements should be: mutual respect and communications. Providers should value your expertise just as much as you value theirs. Okay. It's a two-way street. You are both specialists. Keep that communication open. Keep talking about patients even after that initial referral, patient progress, updates and treatment plans, you know, anything all the way till the end. We also want to have discharge reports. Having a shared patient-centered philosophy. The best collaboration is going to happen when all providers prioritize functional outcomes over quick fixes. No band-aids. Regular case collaboration. So, you get this new referral person referring patients to you. Sorry, my brain just tripped there. You want to have regular check-ins with them. So set up, monthly meetings or quarterly meetings where you meet to discuss either complex cases or wins or, a new evaluation. You're meeting, you're discussing a series of different patients, different, scenarios, and you really want to help continue and ensure that continuity of care. So you're not seeing, referrals like a bunch the first 3 months you talk to them and then they trailed off and then they going up and down. They should be steady and continuous if you keep fostering and working on that working relationship. And sometimes that's, just going out for dinner or happy hour or for coffee. You become friends, with these people. I feel like that is really what creates the best outcomes for our patients when we have very strong, working relationships. And some of mine have become some of my very closest friends. I'm not saying everybody, that's not going to be everybody. You don't have to invite everybody over to your house for dinner on Friday night with your husband or, take your kids to the park together or whatever. But it is kind of nice when it happens that way, but you don't want to be too pushy. Cross referrals, two-way street. A strong network means you're referring to them, they're referring to you. It is not one-sided. So you need to make sure that you're not the only one just referring to the orthodontist, the ENT. They should also be sending patients your way. If you're not seeing that, then you need to figure out, troubleshoot. Oops, sorry, my dog just barked. Figure out, troubleshoot what exactly is going on. Is there a disconnect there on what the importance of your role is, or maybe where your role comes in? And then continue, that educational support and training. So offer lunch and learns, offer to help train their staff so that when they're making a referral to you and they go now up front, that person at the front desk is also, understanding why that referral was made. And, maybe they've met you and they can say, oh my God, I met Brittany. We love her. She's so sweet. She comes in, she's trains us on what we should be looking for, how we can best explain to you what it is that she does. So you want that openness to learning to stay there, right? So I want you to start taking action today. Start building that strong referral network. It does take time. It does take time. It does take a lot of work, but I promise you, you will get there. It is worth it. The right providers will not only enhance your patient's results, but it's going to elevate your practice and your career as a myofunctional therapist. So start reaching out. Please don't let fear keep you. Ask the right questions. You have the right questions. Start building those relationships that are going to make a long lasting impact on your practice. As always, please feel free to reach out with any questions, any topic suggestions. If you found this episode helpful, don't forget to share it with your colleagues. Leave me a review wherever you are listening. If you're in your car, make sure you get home safely first, then you can leave us a review. And until next time, let's keep thinking beyond the dental chair. Take care, everyone, and keep inspiring.